All cardiologists are constantly looking for ways to help prevent vascular disease. There are definite reasons why this can happen at an early stage in life. For example, prolonged periods of stress, being a smoker, having diabetes or maybe high blood pressure over a period of years.
I think this is very important. I think it's a great breakthrough in medicine. In Ireland and the UK, the risk of circulatory disease is one of the biggest killers. Particularly in Ireland, we know that heart disease is huge, and anything that we can do to minimise the risk for any individual, then I think that's very important. We're all too familiar with how many people die suddenly and on post-mortem they're diagnosed as having a heart attack. Many people have heart disease without symptoms. So if we can pick up on the heart disease before it affects them, then I think that's very important, so that we can minimise the risk of stroke and heart attack. We factor in a number of things. We factor in the person's age, their height, their weight, and we ask them some questions about medication, family history and so on. Then we check their blood pressure using a specific machine for turn back time, and we check it 3 times. During that test we ask the person to remain quite still, feet flat on the floor, and to try and chill their thoughts, because even thoughts can change how your blood pressure is. So for that reason we check the reading 3 times. Then we factor in that reading into the computer, and it generates a printout which gives us their biological age. That is the age at which the person is aging, as opposed to their chronological age, which is the number of birthdays. It also gives us their body mass index, it gives us their pulse rating, and it gives us, most importantly, their arterial index, which is whether their arteries are beginning to develop a little bit of plaque. Now we're going to demonstrate the arterial index test, and first we put on the blood pressure cuff, and the lead is over the brachial artery. Now I would ask you to keep your feet flat on the floor and stay perfectly still, and I'm just going to press this button and the cuff will start to feel tighter, and we'll do this 3 times so that we get 3 readings.
We know that people who have early vascular disease develop much stiffer arteries than people who have no such problem. This is because the early signs of vascular disease involve thickening of the lining of the arteries with deposits of cholesterol.